So most sessions follow the same format. So I spend time with people to see if they can contain and self-soothe to enough degree that we can safely move forward to open up this work. I
Mhm.
spend a lot of time doing mindfulness and meditation with people
Mhm.
and make sure that they have that really under their belt before we get started.
Mhm.
It's also really integral to what the way that I like to work
Mhm.
because I spend time with people as they come in and they set their goal for the day. Like, well, I want to get through this interview without falling apart or this, whatever the case may be. So we have a goal. And then we would set aside the goal and use things like acupuncture and breath work and meditation to get them in a really, really calm state.
Mm.
And I'm not talking about I want to clarify one thing. So we talk about being dysregulated. Of course, we wouldn't come at this work in a dysregulated state, right? No fight or flight or fawn. And that's where I think a lot of people get damaged in trauma work is
Mhm.
that it's not identified by the clinician and it's not handled correctly and people aren't helped through it and they keep doing it and they re-injure people. But I go a step beyond that. I don't just want people calm and regulated. I take them to a very, very deep place
Mm.
where I would even say an altered state of consciousness, even though I'm not using any of the substances that lead to that. But I use things like hypnosis and trance and meditation and breath work and acupuncture to get people into that deep, deep state of relaxation.
Mhm.
And then I would do parts work
Okay.
where we would interview the parts, find out what they're holding on to, find out why the part of you won't move forward, find out what need is unmet. Usually there's more than one.
Mhm.
A lot of times it's information, right? A lot of these things happen to us when we don't have all the information.
Mhm.
And talk to these parts of ourselves about giving up some of these strategies because strategies help us in the short term, but ultimately they keep us too armored to really live life.
Mhm. Mhm. Yeah, it's interesting. So parts work, you're talking about IFS in particular.
No, I'm actually not.
Okay, what kind of parts work?
Great clarification. I did EMDR training and I picked up a book by Dr. Paulson, Sandra Paulson,
Okay.
and it's a book on dissociation and severe trauma.
Mm.
And it's the type of parts work that she does, which is not the same as IFS. I'm aware of IFS, I, but I don't know that I could speak too much to it. But instead of naming what I understand from IFS is like this is a firefighter or this part or that part, which makes sense.
Mhm.
um, we actually just connect to the part and find out like what age they are, what they're struggling with, what they need help with.
Mhm. Mhm.
So it is ego state parts work,
Uh-huh.
but it is not IFS.
Uh-huh.